Greetings, health enthusiasts. Today we dive into a fascinating topic, Ozempic. This medication has been making waves in the health community, primarily for its role in managing type 2 diabetes and promoting weight loss. Now, you might be wondering, what exactly is Ozempic? Well, it's an injectable prescription medicine, but it's not your first go-to treatment. It's typically considered for those who've tried other methods without success. Whether you're struggling with blood sugar control or trying to shed some extra pounds, Ozempic might be a game changer. But as with any medication, it's essential to understand that it's not a magic bullet. It's a tool in the arsenal, a potential helping hand in the quest for better health. Now that we've briefly introduced Ozempic, let's delve into how this medication works. Understanding how Ozempic works can help us appreciate its benefits and potential drawbacks. Let's take a deeper dive into the science behind this medication. Ozempic is not just an ordinary drug, it's a synthetic form of a hormone that our bodies naturally produce after meals called GLP-1 or glucagon-like peptide 1. This hormone plays a pivotal role in the regulation of our blood sugar levels. After we eat, our bodies break down the food into smaller components, including glucose, which is then absorbed into our bloodstream. GLP-1's job is to stimulate the release of insulin, a hormone that helps move glucose from our bloodstream into our cells where it can be used for energy. But that's not all GLP-1 does, it also slows down the rate at which our stomach empties after meals. This is important because it means that glucose is released into our bloodstream at a slower, more steady pace, preventing those sudden spikes in blood sugar that can be harmful. Moreover, by slowing down digestion, GLP-1 also makes us feel full for longer, reducing the urge to eat more. Ozempic, by mimicking the actions of GLP-1, helps regulate blood sugar levels and promotes feelings of fullness. It's like having an extra helping hand to manage your blood sugar and appetite. So now we know how Ozempic works. But what impact does it have on the body, particularly the brain? Interestingly, Ozempic does more than just regulate blood sugar levels and appetite. Cutting-edge research suggests that this medication may also have a direct impact on our brain, specifically on areas involved in appetite and reward. Scientists have discovered that Ozempic can influence these neural circuits, potentially leading to changes in our eating habits. Imagine a drug that could quiet those insistent cravings for that second piece of cake or those extra handfuls of salty, crunchy chips. Fascinating, isn't it? By impacting the brain's reward system, Ozempic could play a significant role in reducing overeating, a common struggle for many people. This is not to say that Ozempic is a magic pill for weight loss, but understanding its effects on the brain gives us a more complete picture of how this medication works. Next, we'll discuss some controversies surrounding Ozempic and weight loss. Like any medication, Ozempic is not without controversy. One of the key debates surrounding this drug relates to the notion that obesity is a choice. Some argue that obesity is a result of personal choices and lifestyle habits, while others believe it's a complex issue influenced by genetic, environmental and psychological factors. Ozempic, as a medication that aids in weight loss, enters this debate with a unique perspective. It suggests that obesity, at least for some, might be a condition needing medical intervention, rather than a simple matter of willpower. Another controversy revolves around the concept of addiction transfer. This is the idea that when one addiction is resolved, another may take its place. For instance, someone might stop overeating only to start smoking or drinking excessively. However, Ozempic might disrupt this process. As a GLP-1 receptor agonist, it not only affects appetite, but also acts on pleasure centers in the brain, potentially reducing the desire for other addictive substances or behaviors. However, it's worth noting that these are complex issues, and how Ozempic interacts with them may vary greatly from person to person. Like any drug, it's not a cure-all, and should be used as part of a comprehensive treatment plan. Lastly, let's look at some potential downsides to Ozempic. While Ozempic has many potential benefits, it's important to consider the downsides as well. As with any medication, Ozempic is not without its potential risks. One often overlooked downside to weight loss drugs like Ozempic is the potential for muscle loss. Muscle tissue burns more calories than fat, even at rest, so losing muscle can actually slow down your metabolism, making it harder to maintain weight loss in the long run. Furthermore, it's vital to remember the bigger picture. Diabetes, a condition that Ozempic is also used to treat, is a serious illness that can lead to life-threatening complications. While weight loss drugs can carry risks, it's important to weigh these against the potential risks of unmanaged diabetes. There's also the question of what happens when you stop taking Ozempic. Some people may experience weight gain after discontinuing the drug, which can be disheartening after working hard to lose weight. It's crucial to pair any weight loss medication with sustainable lifestyle changes to maintain results. Now let's consider the future of Ozempic. The demand for this drug is high, and it's easy to see why. With its dual ability to manage diabetes and aid in weight loss, it's a seductive solution for many. But we must be cautious. Wide-scale use could lead to unforeseen consequences such as potential shortages or an increase in counterfeit drugs. Moreover, we should ask ourselves, will people exercise less if they can just take Ozempic? Will it be seen as an easy way out, discouraging people from making necessary lifestyle changes? These are questions that need careful consideration as we move forward. Remember, while Ozempic could be a game changer for some, it's not a magic bullet. Always consult with your healthcare provider before starting a new medication. It's essential to have open conversations about the potential downsides and future implications of drugs like Ozempic. As we continue to explore and understand these medications, we're better equipped to make informed decisions about our health. Before we wrap up this deep dive into Ozempic, I want to take a moment to remind you all that while we strive to provide you with the most current and comprehensive information, it's crucial to remember that nothing can replace a conversation with your healthcare provider. They understand your unique health situation and can guide you to make the best possible decisions. If you're considering Ozempic or any new medication, please consult with them first. Now, if you found this video informative and helpful, please give it a thumbs up and share it with anyone you think might benefit from this information. We're all about spreading knowledge to help you make informed health decisions. If you want more content like this, don't forget to hit the subscribe button and the notification bell so you won't miss any of our upcoming videos. Your engagement helps us continue to bring you content like this. So, like, share, and subscribe, but most importantly, take control of your health by staying informed and consulting with your healthcare provider. Remember, your health is your wealth. Stay tuned for more health-related content. See you in the next video.